Hello and welcome. Today we're going to talk about a very important and personal topic that affects many women over 60, vaginal atrophy. You might have experienced dryness, discomfort, or pain during intimate moments, and maybe it left you feeling a little alone or unsure. It's important to know, you are not alone, and this is completely normal. After 60 our bodies go through many changes, and vaginal atrophy is one of them. It's a natural process caused by a drop in hormone levels, especially estrogen, which helps keep the vaginal tissues healthy and elastic. These changes can cause symptoms ranging from mild discomfort to more serious issues that affect daily life and even your relationships. The most important thing is not to be embarrassed or stay silent. Often, stigma or uncertainty makes us avoid talking about something that could greatly improve our quality of life if we just reach out for help. Vaginal atrophy is not something to be ashamed of. Instead, it's a signal from your body that needs care and attention. In this video, we'll explore why vaginal atrophy happens after 60, what signs to watch for, and most importantly, how to treat it without shame or fear. Modern medicine offers many effective and safe ways to improve your health and bring comfort back to your life. Remember, knowledge is power. Every woman deserves to feel confident, comfortable, and happy at any age. Together, we'll take the first step toward understanding and caring for yourself because your health is your greatest treasure. Before we begin, let me ask you something important. Have you ever felt that certain topics about women's health after 60 are avoided, even though they matter so much? If you've ever thought, yes, this needs to be talked about, please drop a simple yes in the comments. It tells me you're part of the group that's ready to bring these conversations into the light, without shame. And don't forget to subscribe to Senior Longevity Tips, where every day we share real, practical advice to help you live longer, feel stronger, and embrace this stage of life with confidence. Now, let's talk honestly about vaginal atrophy, why it happens, and what can be done. Let's dive a little deeper into what exactly vaginal atrophy is. Simply put, it means that the tissues inside your vagina become thinner, drier, and less flexible. This happens because of the lower levels of estrogen after menopause, which usually supports the health and strength of these tissues. You might notice symptoms like dryness, itching, or burning. Some women also feel discomfort or pain during sex, which can be frustrating and upsetting. It's important to understand that these symptoms don't mean there's something wrong with you. They are a natural part of aging and hormonal changes. Many women hesitate to talk about these changes, but sharing your experience with your doctor can lead to solutions that truly make a difference. The key is recognizing these signs early and knowing you don't have to suffer in silence. Taking care of this aspect of your health can help you regain comfort and confidence. Remember, your body deserves respect and attention at every stage of life. Let's take a closer look at why vaginal atrophy happens, especially after the age of 60. The main reason lies in the natural decline of estrogen, a hormone that plays a crucial role in maintaining the health of vaginal tissues. Before menopause, estrogen keeps the vaginal walls thick, elastic, and well lubricated, which means you feel comfortable and confident in your body. But as estrogen levels drop during and after menopause, these tissues begin to thin and dry out, losing their flexibility and natural moisture. This hormonal change can feel like a sudden shift in your body, a loss of control that may bring confusion, frustration, or even sadness. It's important to know that this is not a sign of something wrong with you, but rather a natural part of aging. Understanding this helps many women feel less alone and more empowered to seek help. Beyond hormones, other factors can make vaginal atrophy worse. Certain medications, smoking, chronic health conditions like diabetes, and even long stretches without sexual activity can all affect blood flow and tissue health. When the blood supply decreases, the tissues get less oxygen and nutrients, making symptoms more pronounced. The good news is, knowing these causes can give you back a sense of control. When you understand why these changes happen, it becomes easier to take the right steps to care for your body. Remember, your body has been with you through every stage of life. It deserves patience, kindness, and attentive care now more than ever. You might be wondering, is this the new normal? Do I just have to accept discomfort? The answer is no. Many women find relief and regain their quality of life through treatments and lifestyle adjustments. And you can too. The first step is awareness. By recognizing the reasons behind vaginal atrophy, you open the door to solutions and to reclaiming your comfort and confidence. You are not alone, and help is within reach. One of the biggest reasons many women hesitate to seek help for vaginal atrophy is the feeling of shame or embarrassment. Talking about intimate health issues is often seen as taboo, especially in older generations where such topics weren't openly discussed. This silence can create a sense of isolation, making you feel as if you are the only one dealing with these uncomfortable changes. But the truth is, vaginal atrophy is extremely common among women over 60. Millions are experiencing similar symptoms, and there is absolutely nothing to be ashamed of. Recognizing this is the first step toward breaking down the walls of stigma and shame. When you hold back and don't speak up, symptoms can worsen and affect your quality of life. Pain or discomfort during intimacy can lead to avoiding closeness with your partner, which might cause feelings of loneliness or frustration. These emotions are natural, but they don't have to rule your life. Opening up, whether to a trusted healthcare provider, a close friend, or your partner, can feel scary at first. But it is also an incredibly freeing and powerful step. Sharing your experience allows you to get the support you deserve and access treatments that can make a real difference. Think of this process like shining a light into a dark room. Once you bring these hidden feelings and symptoms into the open, you create space for healing and understanding. You reclaim your power and remind yourself that your health and happiness matter deeply. Remember, your body is your lifelong companion, and treating it with kindness and respect includes acknowledging and addressing its changes without shame. You are strong, you are worthy, and you deserve to live comfortably and confidently, no matter your age. Understanding the symptoms of vaginal atrophy is key to recognizing the condition early and seeking the right care. Many women might dismiss these signs as just part of aging or feel hesitant to talk about them, but knowing exactly what to look for can empower you to take control of your health. Common symptoms include vaginal dryness, which can cause discomfort or itching, especially during intimacy. You might also notice burning sensations, irritation, or even mild bleeding after sex. Sometimes, there is pain not only during intercourse but also during everyday activities like walking or sitting. These symptoms can significantly impact your quality of life, but the good news is, they're manageable. Another important symptom to watch for is urinary changes. Vaginal atrophy can lead to increased frequency of urination, urgency, or even infections. This happens because the tissues around the urethra are also affected by lower estrogen levels, making them more sensitive and vulnerable. It's essential to listen to your body and not ignore these signs, even if they seem small or embarrassing. Early recognition means you can start treatment sooner and reduce discomfort quickly. You might feel worried about how these symptoms affect your relationships or daily life. That's a valid concern, and it's okay to acknowledge that. But remember, you don't have to suffer in silence. Sharing what you experience with your healthcare provider can open doors to effective solutions tailored just for you. By understanding these symptoms, you take the first step towards reclaiming your comfort and confidence. This knowledge is your tool for self-care and empowerment, because your well-being matters at every age. When it comes to managing vaginal atrophy, it's empowering to know that there are effective treatment options available, and that you have the right to choose what feels best for your body. The thought of medical treatments might feel overwhelming or even intimidating, but understanding your options can help reduce anxiety and give you back a sense of control. One of the most common and effective treatments is local estrogen therapy. Unlike systemic hormone replacement therapy, local treatments target the vaginal tissues directly, helping to restore moisture, elasticity, and thickness without affecting the whole body. This means relief from dryness, irritation, and discomfort is often noticeable within weeks. Knowing that there are treatments designed specifically for your needs can bring hope and reassurance. For women who prefer to avoid hormones, there are also non-hormonal options such as vaginal moisturizers and lubricants. These can provide immediate comfort during intimacy and help improve daily symptoms. Sometimes, lifestyle changes, like staying hydrated, avoiding irritants like harsh soaps, and engaging in regular gentle pelvic exercises, can make a significant difference. It's natural to have questions or doubts about starting treatment. You might worry about side effects or wonder if it's too late to help. These feelings are completely normal. What's important is that you don't let fear or embarrassment hold you back from seeking care that can improve your quality of life. Remember, taking the step to explore treatment options is an act of self-respect and love. You deserve to feel comfortable, confident, and joyful in your body. Every woman's journey is unique, and your healthcare provider can work with you to find the best plan tailored to your needs and preferences. By embracing these treatments and care strategies, you reclaim your power over your health and happiness. You're not just surviving the changes, you're actively thriving through them. Another vital aspect of managing vaginal atrophy is understanding the importance of open and honest communication, not only with your healthcare provider but also with your loved ones. For many women, discussing intimate health issues can feel uncomfortable or even embarrassing. But keeping silent often leads to feelings of isolation and prevents you from getting the support and treatment you deserve. Imagine how liberating it feels to finally share your experience with someone you trust, a doctor, a partner, or a close friend, and to realize that you are not alone. This simple act of opening up can lift a heavy emotional burden and bring relief in itself. When you speak your truth, you invite understanding, compassion, and connection. Communication also empowers you to advocate for yourself. Sometimes, doctors may not bring up vaginal health unless you mention it first. By taking the initiative to discuss your symptoms, you ensure that your concerns are heard and addressed. Remember, you are your own best health advocate. Talking openly can also strengthen your intimate relationships. When your partner understands what you're going through, they can provide emotional support and adjust expectations. This openness fosters intimacy, trust, and closeness, elements that are essential to a healthy relationship at any age. If the idea of discussing this topic feels daunting, start small. Write down your symptoms and questions, practice what you want to say, or bring a trusted person with you to appointments. Taking these steps can build confidence and make the conversation easier. Your feelings are valid, and your needs are important. By breaking the silence, you open the door to healing, understanding, and renewed joy in your relationships and life. Taking care of yourself emotionally and mentally is just as important as managing the physical symptoms of vaginal atrophy. Many women find that the emotional impact of these changes can be just as challenging as the physical discomfort. Feelings of frustration, sadness, or even a sense of loss regarding intimacy and femininity are common, and completely understandable. It's important to acknowledge these feelings instead of pushing them aside. When you allow yourself to recognize the emotional side of this experience, you create space for healing and growth. Suppressing emotions often leads to increased stress, which can even worsen physical symptoms. Remember, you are not defined by these changes. Your worth and beauty go far beyond any physical symptoms. Embracing self-compassion during this time can be transformative. Treat yourself with kindness and patience, just as you would a dear friend facing a difficult moment. Seeking emotional support is not a sign of weakness but a courageous step toward well-being. Whether it's talking to a counselor, joining a support group, or simply confiding in a trusted friend, connecting with others who understand can make a world of difference. Also, consider incorporating gentle self-care practices into your routine. Activities like meditation, journaling, or gentle exercise can help manage stress and foster a positive mindset. These small daily rituals are powerful reminders that your well-being matters. You deserve to feel whole, joyful, and connected, not just physically but emotionally and mentally too. By honoring your feelings and nurturing your spirit, you reclaim your sense of self and empower yourself to navigate this phase of life with grace and confidence. Living with vaginal atrophy after 60 can sometimes feel overwhelming, especially when symptoms interfere with your daily life and intimate relationships. But it's important to remember, you are not alone, and there are practical strategies to help you regain control and improve your quality of life. One of the most empowering steps you can take is to build a strong support network. This includes healthcare providers who specialize in women's health, friends who listen without judgment, and perhaps most importantly, a partner who understands and respects your experience. Surrounding yourself with people who offer empathy and encouragement makes a profound difference. It creates a safe space where you can share your feelings openly and without fear of misunderstanding. You might worry about burdening others or fear being misunderstood. These feelings are common, but remember that true connections are built on honesty and vulnerability. When you allow others into your experience, you open the door to deeper relationships and meaningful support. This emotional safety net can help you face challenges with greater confidence. In addition to emotional support, educating yourself about vaginal atrophy is a powerful tool. Knowledge helps reduce fear and uncertainty. Understanding what's happening in your body, why these changes occur, and how treatments work can transform anxiety into empowerment. When you feel informed, you are more likely to make decisions that are right for your unique needs. Setting realistic expectations is also key. Healing and managing symptoms take time, and it's okay to have ups and downs along the way. Celebrate small victories, like a day without discomfort or a positive conversation with your doctor. Each step forward is progress. Remember, this phase of life is about embracing your wisdom and self-awareness. It's about honoring your body's story and responding with compassion and care. By leaning into support, staying informed, and practicing patience, you reclaim your power to live fully and joyfully. You deserve to feel vibrant, connected, and confident every day. Your journey with vaginal atrophy does not define you, it is simply one part of your rich, meaningful life. Starting the conversation about vaginal atrophy can feel like one of the hardest parts of the journey, but it is also one of the most powerful. Whether you choose to open up to your doctor, your partner, or a trusted friend, each step you take toward honest communication is an act of courage and self-respect. Silence often creates distance and isolation, while words, spoken with sincerity, can bring relief, understanding, and connection. When speaking with your doctor, remember that this is their role, to listen, to support, and to help you find solutions. No symptom is too small or too embarrassing to share. Physicians who specialize in women's health have heard these concerns many times before, and they understand how deeply such issues can affect daily life. Try being straightforward, even with simple words. I've been experiencing dryness and discomfort, and I'd like to know what can help. A clear, direct statement like this opens the door for a meaningful discussion and personalized care. Conversations with your partner can be equally important. Vaginal atrophy does not just affect the body, it can influence intimacy, closeness, and the way you feel about yourself in a relationship. By gently expressing your feelings, whether it's frustration, sadness, or the desire for greater understanding, you invite your partner to walk beside you in this experience. Honest dialogue can ease tension, reduce misunderstanding, and often strengthens the bond between you. Many couples find that openness leads not only to solutions but also to deeper trust and intimacy. And don't overlook the value of supportive friendships. Sharing your experience with someone you trust can feel liberating, especially if you have been carrying the weight of silence for a long time. You may be surprised to discover that your friend has faced similar struggles. In this way, your honesty can inspire others to seek help, breaking down stigma and replacing it with solidarity. Most of all, remember that speaking about vaginal atrophy is never a weakness, it is an expression of strength, self-awareness, and self-care. By giving voice to your needs, you affirm your right to comfort, well-being, and joy. As we come toward the close of this discussion, it's important to pause and reflect on one essential truth: vaginal atrophy may be a natural and common part of the aging process for many women over 60, but it does not have to control or diminish the quality of your life. Too often, women carry the silent belief that discomfort, dryness, or pain are simply something they must endure as they get older. But the reality is far more hopeful. With the right information, gentle medical support, and small but meaningful lifestyle adjustments, you can rediscover a sense of ease, vitality, and joy within your own body. Knowledge truly is power. When you understand what is happening, why it occurs, and what solutions exist, you replace fear with clarity. You open the door to choices, whether that means exploring local estrogen therapy, using hormone-free moisturizers, embracing new self-care practices, or simply finding the courage to start a conversation with your healthcare provider. Every step you take toward relief is a step toward reclaiming comfort and confidence. Healing is not a race, it is a journey. Some days may feel easier than others, and progress often arrives in small, almost invisible ways. Yet those little victories matter. Perhaps it's enjoying an evening walk without the distraction of discomfort. Perhaps it's a tender moment with your partner where intimacy feels safe again. Or perhaps it's the courage you feel after voicing your needs to your doctor and being heard. Each of these milestones is worth honoring, because they remind you that change is possible. Above all, remember that your experience is deeply valid. Your feelings, whether of frustration, sadness, hope, or relief, are part of your unique story, and none of them lessen your worth. Investing in your health is not selfish, it is an act of love toward yourself and toward the life you still want to live fully. You deserve to feel vibrant, comfortable, and deeply connected, not only with others but also within your own skin. This season of life can be one of resilience and renewal. By seeking knowledge, practicing patience, and embracing compassionate care, you affirm a powerful truth: you are more than your symptoms, and your well-being is worth every effort. It's important to remember one powerful truth: vaginal atrophy is a common and manageable part of life after 60. While it may feel isolating or uncomfortable to face these changes, you are not alone, and you have the strength and resources to navigate this journey with dignity and grace. Embracing this reality begins with acceptance. Accepting that your body is evolving doesn't mean giving up, it means honoring your life's journey and recognizing the wisdom that comes with age. This acceptance opens the door to self-care, healing, and renewed confidence. It allows you to shift your focus from fear or shame to empowerment and hope. One of the most profound acts you can do for yourself is to prioritize your health without apology. When you choose to invest in yourself, you send a message that you are worthy of care and respect, no matter your age. It's also essential to spread this knowledge to the women around you. Sharing what you've learned can break the silence and stigma that so often surround vaginal health. When women come together to talk openly and honestly, they create communities of support that uplift everyone involved. Your voice can be a beacon of hope and encouragement, inspiring others to seek help and reclaim their lives. Now I'd love to hear from you. Have you or someone close to you faced this issue but felt too embarrassed to talk about it? What helped you most? Was it a lifestyle change, a medical treatment, or just finally realizing you're not alone? Share your thoughts or questions in the comments. This is a safe, respectful space, and your voice might be exactly what another woman needs to hear. And if this video is helping you feel less alone, please give it a quick thumbs up so more women over 60 can find it too. And don't forget to subscribe to Senior Longevity Tips. This is your daily place for wisdom, health, and the little choices that make life after 60 brighter, stronger, and more comfortable. And before we wrap up, let me just say thank you for choosing knowledge over silence, for putting your health first, and for being part of this Senior Longevity Tips community. Talking about vaginal atrophy may feel uncomfortable at first, but every time we speak openly, we take away the shame and replace it with strength and understanding. Remember, your experience is unique but also part of a larger sisterhood of women who face similar challenges. Together, you can redefine what it means to age gracefully and healthfully, showing that growing older is not a decline but a powerful evolution filled with strength and beauty. Every step you take toward understanding, healing, and self-love is a victory. Keep nurturing yourself, stay curious, and reach out when you need support. You deserve a life full of joy, connection, and confidence. Let this journey be one of empowerment, one where you reclaim your body, your voice, and your life on your own terms. Take care of yourself, you are never alone on this journey.